So my name is Hallie Metzler, and I am with Castlewood Treatment Centers, which is in St. Louis, Missouri, Monarch Cove, which is in Monterey, California, and now we have the PHP and IOP in Alabama, which is called the Highlands, that just opened up. So before, I think you guys knew us just in St. Louis. Now we've kind of expanded. Eating disorders is really near and dear to my heart. My great-grandmother was anorexic. My grandmother struggled with body image issues. My sister went to a not very good eating disorder treatment center in California, and I myself am in recovery. And I really didn't get into recovery until Ann Martin from the Betty Ford Center came to me on my year birthday. And she said, "Congratulations, Hallie, that you have a year of sobriety." She says, "But let me tell you that I know a lady who's got 35 years of sobriety, and every single day of her 35 years, she binges and purges. What kind of recovery do you want?" And I knew I wasn't done. And I knew I really had another addiction to tackle. And I know a lot of you guys deal with men and women who get clean and sober, and then 4 months, 5 months down the road, they wonder why they're gaining weight. And it's like, well, honey, you've been using methamphetamines for 15 years. And slowly this eating disorder pops up that they never even knew existed. And so I'm here today to talk to you about what we do. I think Castlewood was always known as SIN, Castlewood, your most traumatic, hardcore eating disorder trauma patients. And we had Mark Schwartz, who is no longer with us, who really focused on IFS and really treating the very challenging hardcore client. With Mark and Lori no longer being with us, it has really allowed us to bring in some evidence-based modalities. We now do EMDR, DBT, CBT, exposure, expressive, and so I think before we really got into a niche of just IFS, and I think that really did not help the client who might have came in that just struggled with some bulimia and maybe had some anxiety issues. IFS wasn't the right fit. Maybe they need to try DBT or CBT. So we're really trying to also get all of our therapists, seeds, have them be certified eating disorder specialists. Castlewood takes male and female. Most people don't know we take males, 16 and up. We also can do feeding tubes, all the way to PHP and IOP. So the reason I joined was I had an amazing mentor, Drew Paxton, and I was really looking for another really good mentor, but I was looking for one in a female. And Nancy Albus, who is the CEO, has been with Castlewood for 10 years, and one of the most amazing mentors I think I could have besides those of you who know Drew. Just a really great, transparent, honest gal. We, 97% insurance, I love that. You know, the only ones we don't take are probably the ones most of you don't, which is the Kaiser, the TRICARES, and the Medicares, but we can take most insurance. One of the things I kind of wanted to walk you through is a typical client. And so Jenny is 32 years old. She struggles with OCD. She has some trauma, and she's anorexic. She's at 65% of her ideal body weight. So 65% for us is where she would probably need a tube if she is willing. Now the great thing about us, because we have 24-hour medical stabilization, is they can be in a residential setting. So they don't have to be in a hospital with the tube. They can actually be walking around and doing psychodrama and be actually incorporated in groups. One of the things we found when we had people who needed stabilization or refeeding, if they weren't doing the tube, is we were setting them up for a binge. We were putting 3,000 calories in front of this client during breakfast, lunch, and dinner, and we were asking them to consume 3,000 calories, and that just really wasn't ideal. So what we try to do is 50% is through the tube if they actually need it. The other 50% is they're learning what a healthy meal looks like. They're learning what actually portions look like. If someone refuses, then we'll try just to do it through food, and we'll try to give it to them every couple hours so that they can get the consumption that they need. With Jenny, a typical day would be she would go to breakfast. Again, the 50-50, a nutritionist would be eating with the clients. After that, she would probably do maybe a body image group. Then she would go see her psychiatrist. Then she will probably do an exposure therapy group, and then she would have lunch. Again, another 50-50 with a nutritionist. Then she'd see her psychiatrist. She might do art therapy. Might see her anxiety therapist if she specializes in, she needs some anxiety. And then she might do an experiential group. Then dinner, and then maybe yoga afterwards. I would say that our work is not for someone who, it's really rough. I mean, and again, it's not for everyone. They are doing they are in group from 7 in the morning till 7 in the evening. They get 6 individual sessions a week. I know a lot of people say they do individualized treatment. They're doing 4 with their individual, 1 with their psychiatrist, 1 with their dietitian. The thing I love about Family Week is we have family. When the families come, the mom gets her own therapist, the dad gets his own therapist, the sister might get her own therapist. So when we're doing family, the individual therapists are also there so that they're able to really be an advocate for that family member. Family is every 6 weeks for 5 days, and it's very intensive as well. We take 65% ideal body weight for our inpatient. For IOP, it's 75% ideal body weight. We also have a step-down program, which goes from residential, step-down, then partial. What we found was those who were transitioning from a structured residential, then go into an outpatient, they had that less structure, and there was really room for slips. And so we wanted to create a step-down program. We offer free transitional housing. We just found that, you know, we wanted to be able to provide that. So as long as they're in our PHP, IOP, they don't pay for housing, it's free. Some programs it's, you know, $3,000, we just believe it's free. For gender, the men have their own rooms, the women have their own rooms. I do get that question. What is our food philosophy? There are no bad foods. We truly believe in terms of our medication approach, food is medicine. Number 1, food is medicine. After that, then, you know, we will look at the psychiatric component. Monarch Cove in California is 12 beds. We're JACO certified. We just got CARF accredited in St. Louis. We're the first ones to ever get eating disorder CARF accreditation, and now we just passed JACO. I think we only had 2 errors out of like 3,000, and 1 was a dirty oven. So mad. The other thing we're doing is we're creating bridge sessions. So one of the things I found that we weren't doing very well was if someone was coming to us, we can take someone for 2 weeks, do the stabilization, and then send them back to you guys. What I wanted to do is create bridge sessions so that if they're going back to Cirque Lodge, or if they're going back to Pine Grove or Promises, we're having those conversations with the therapist. And so when that client leaves on Thursday, they know Friday where they're going, so there's no room for slip. What we found is if they don't go to where they're supposed to go the next day, there's a huge weight loss over that weekend, and then they might need inpatient versus outpatient. And so for me, it's really, really important that I'm having those bridge sessions with you guys so that they know on Thursday they're discharged, they're going to you guys on Friday. I think that's my time. So are there any questions?
Where in Alabama did you open?
Birmingham, Alabama. Dr. Nicole Siegfried is our clinical director there, and she's heading up the Birmingham. And we'll be doing adolescent in 6 months as well in Birmingham.
To be in office.
Any other questions? Yes, Rick.
Yeah, I just wanted to say that I was up at Castlewood for Referent Weekend just a couple of weeks ago, and I'd done work with Castlewood, and I'd known Hallie for a while, but that was the first opportunity that I had to go actually see the place and sit down and talk to everyone, and they were really impressive. You know, it takes a little bit to impress me, but I was. It was very, very nice. If I had a loved one with an eating disorder, I would hesitate to say.
It's a great place. I visited there too, and I just told her this morning I want to get to Monterey too, and very excited. And maybe you can show me around Birmingham too. Any other questions? They've got a great facility, all the facilities, top notch, and your insurance is amazing. What you guys get out of insurance.
And you treat 16 and older?
16 and up.
Wow.
That's all. Awesome.
Anything else? Thank you.
Thank you.